Cyclopam tablet is used as a pain-relieving and anti-spasmodic medicine. It is used for relieving spasmodic pain associated with stones in the kidney or gallbladder. It is also helpful in treating blockage or obstruction in the intestine and menstrual pain and cramps. Active ingredients. It is a combination medicine containing paracetamol and dicyclopam as its active ingredient. Paracetamol works by inhibiting the production of a chemical substance responsible for pain, swelling, and inflammatory responses. Dicyclopam relaxes the muscles and improves the cramps and spasms. Uses. For relieving spasmodic pain and cramps. Renal colic, sharp pain due to a stone in the urinary tract. Intestinal colic, cramp-like pain in the intestine. Biliary colic, pain in the middle to the upper right area of the stomach. Painful menstruation and cramps. How to use. Take this medicine and the dose and duration as advised by a doctor. Swallow it as well. Do not chew, crush or break it. Cyclopam tablet may be taken with or without food, but it is better to take it at a fixed time. Oral dosage and administration in adults. The recommended initial dose is 20 mg 4 times a day. After 1 week treatment with the initial dose, the dose may be increased to 40 mg 4 times a day, unless side effects limit dosage escalation. If efficacy is not achieved within 2 weeks or side effects require doses below 80 mg per day, the drug should be discontinued. Documented safety data are not available for doses above 80 mg daily for periods longer than 2 weeks. Contraindications. If you are allergic to paracetamol, dicyclopam, or any other ingredients of cyclopam tablet. If you are taking any other medicine that contains paracetamol or dicyclopam. If you have urinary tract disorder, stomach or intestinal ulcers. If you have any heart-related problem or bleeding disorder. If you have urinary tract disorder, obstruction in urethra or ureter. If you have an eye disorder called glaucoma, or if you are breastfeeding. If you have a muscle-related disorder called myasthenia gravis. Precautions. Cyclopam may interact with other medicines. Discuss with your doctor about all the medicines, supplements, or herbal preparation you are taking. Also inform your doctor if you have a planned surgery or vaccination scheduled. Cyclopam tablets should be used with caution in patients with liver disease. Dosage adjustment of cyclopam tablet may be needed. It is unsafe to consume alcohol with cyclopam tablet. Side effects. Most side effects of cyclopam fade away as your body gets accustomed to the drug. However, if the side effects persist, please consult a doctor at the earliest. Avoid driving when on medication, as it affects concentration. Keep away from alcohol, as a combination might intensify sleepiness. The common side effects of cyclopam are headache, dizziness, sleepiness, nausea, stomach discomfort, constipation, loss of appetite, blurred vision, weakness.